My name is Dr. Scott Phillips. I'm a medical toxicologist, and it's a physician that specializes in health effects of chemical substances on people. And I'm going to discuss some questions regarding disinfectant byproducts in health. Now, disinfection byproducts occur when chlorine or chloramine are added to water during the purification process because they react with organic matter such as leaves and things that might be in dirt that occurred during the collection of water. Water treated with chlorine or chloramine will form disinfection byproducts and is very common nationwide and really worldwide where chlorine or chloramine are used in the disinfection process to keep the water safe. Disinfectant byproducts at the concentrations that occur in drinking water would not be expected to cause adverse health effects. The EPA regulates disinfectant byproducts such as trihalomethanes to concentrations sufficiently low so they will not cause health effects. So with showering, you will get an increased amount of disinfectant byproducts, particularly in the steam phase of the air. But with all substances, we know that it's the amount of the substance you're exposed to in the duration of time that leads to any kind of health effects. In this situation, we know that the concentrations, even with showering, are not sufficient to cause health effects. There have been questions that have been brought up about disinfection byproducts and miscarriage. The scientific literature is firm that there is no association between disinfection byproducts and miscarriage at the concentrations found in drinking water. There are some laboratory studies that have shown disinfectant byproducts at high concentrations for prolonged periods of time may cause cancer in some species in some experiments, but it does not cause cancer in people at the levels we use to disinfect water. Reproductive health and disinfection byproducts has been studied, and the results have been somewhat inconclusive. As with all research, the studies are still ongoing, and at the current time, there's no strong evidence to support an association between adverse reproductive health and disinfection byproducts.